Hello again, everyone. It's Dr. Mike. We're back here for tip number 50. Now, there are 101 tips in this ebook. So we're on tip number 50. And folks, this is interesting. I never thought when we wrote this book that we would ever put these on videotape, much less me videotaping 50 of them. So thank you for watching. Please make sure you go over to met101ebook.com and download a free copy. And if you don't mind, email me at drmike@postrehab.com. Tell me what you think about our ebook series, our tip series. If it helps you, if it doesn't help you, I sincerely appreciate it. With that, we're going to talk about tip number 50. Tip number 50 relates to tip number 49, which looked at MET criteria. Tip number 50 is, how will the MET criteria help me manage my clients? Let me read it. We'll talk about it. The criteria will not help you manage the client through the MET program. The criteria are more of a safety tool versus a management tool. The criteria is designed to prevent medically unstable clients from entering an MET program. And folks, it's that simple. The criteria was designed as a guardrail to keep the medical exercise or medical fitness professional from working with the inappropriate client. As I mentioned in tip number 49, there have been situations where patients have been referred to me by a physician that were inappropriate for physical therapy. They needed to be medically stabilized with the skills that a physician or nurse practitioner or physician's assistant had that I did not have. If I had worked with that client, it would have been far outside of my scope. It would also have been outside of my ethical range. And if that client had been made worse by the services I provided, I would have been in pretty much hot water. So the criteria is designed to keep you out of trouble. And again, it doesn't help you manage the client, but it helps you make sure that you have the greatest opportunity for producing a positive functional outcome for the individual that's referred to you. So one last thing. If you are a medical exercise training practice owner, one of the things we find in some of our younger, more eager medical exercise professionals is they want to work with everybody. They want to prove they can do everything. Every once in a while, look over the shoulder of that young, eager medical exercise professional. Or make sure that at the end of the day, when they're summarizing what they've done with clients, that you ask them about the assessment process they use on their new clients and ask them if they understand the criteria and did the client meet all the criteria. That becomes important. I think one of the things that we have to do in medical exercise training is start looking over the shoulder of our colleagues to say, hey, you know what? That wasn't so good. Maybe we need to look at that again. Because folks, I tell you this, in the medical community, we do it. We should do it more because sometimes we can have the wrong thought process and become focused in on one thing, and we need to look at the broader picture. So with that said, please, let's try to share more information as medical exercise professionals. If you have any questions, email me at drmike@postrehab.com. And with that said, please make sure you go over to met101ebook.com, download your free copy, and we will see you in tip number 51. Take care.